Why cancer comes back years later. Dormant cancer. Imagine being told that cancer is gone, only to discover years later that it has returned. Where was it hiding all that time? In some cases, a small number of cancer cells may survive treatment even when scans show no visible signs of disease. These remaining cells can sometimes travel away from the original tumor and settle inside another tissue or organ. Instead of immediately forming a new tumor, some of these cells enter a quiet state known as cancer dormancy. A dormant cancer cell is still alive, but it has temporarily stopped, or greatly slowed, its normal cycle of growth and division. Because most cancer treatments are designed to attack rapidly dividing cells, dormant cells may be more difficult to eliminate. Chemotherapy can destroy many active cancer cells, yet a sleeping cell may escape because it is not dividing at that moment. Radiation and targeted treatments may also remove visible disease without necessarily reaching every microscopic cell hidden throughout the body. These surviving cells can be so rare that standard medical scans are unable to detect them. A scan may therefore show no evidence of disease, even though a few microscopic cells remain below the level of detection. Dormant cancer cells can hide in specialized environments within bone marrow, lungs, liver, brain, or other tissues. The surrounding tissue can create a protective niche that supplies survival signals while keeping the cell in a quiet state. Nearby blood vessels, support cells, immune cells, and structural proteins can all influence whether a cancer cell sleeps or grows. The immune system may also help keep dormant cells under control by recognizing them and preventing their expansion. This creates an unstable balance. The cancer cell survives, but immune pressure prevents it from forming a visible tumor. Dormancy may last for months, years, or sometimes decades, depending on the cancer type and the biology of the individual tumor. Breast cancer, prostate cancer, melanoma, and some kidney cancers are known for the possibility of recurrence long after initial treatment. But what causes a sleeping cancer cell to wake up? Scientists believe that changes in inflammation, immunity, hormones, metabolism, aging tissue, or the local environment may contribute to reactivation. When the protective balance changes, dormant cells may receive signals that encourage them to begin dividing again. New blood vessels can grow nearby, providing oxygen and nutrients that allow a microscopic cluster to expand. The awakened cells may also change their genetic activity, metabolism, and interaction with the immune system. Some can develop new mutations or lose the molecular targets that earlier treatments were designed to attack. This means the recurrent cancer may not behave exactly like the original tumor. It may grow in a different organ, respond differently to treatment, or develop resistance to medicines that once worked. When cancer returns near the original location, doctors may call it a local or regional recurrence. When it appears in a distant organ, it is considered metastatic recurrence and is named after the original cancer type. For example, breast cancer that later appears in bone is still breast cancer, not bone cancer. Doctors use scans, laboratory tests, biopsies, and sometimes circulating tumor DNA to search for signs of residual or returning disease. Minimal residual disease describes the tiny amount of cancer that may remain after treatment, but cannot always be seen through conventional imaging. Researchers are studying blood-based tests that may detect molecular traces of cancer before a new tumor becomes visible on a scan. However, these tests are not available or equally reliable for every cancer, and results must be interpreted by specialists. Scientists are also developing treatments designed specifically for dormant cells and the environments that protect them. One strategy is to destroy dormant cells before they awaken. Another approach is to keep them permanently asleep so they cannot begin growing again. Researchers are also studying how to strengthen immune surveillance and block the signals that trigger reactivation. At present, there is no single approved treatment that can eliminate every dormant cancer cell across all cancer types. This is why long-term follow-up remains important, even after successful treatment and years without visible disease. Recurrence does not mean that treatment failed or that a patient caused the cancer to return. It reflects the extraordinary ability of a small number of cancer cells to survive, adapt, hide, and sometimes awaken. Understanding dormancy may eventually help doctors prevent recurrence before a new tumor has a chance to form. This video is for education only and does not replace medical advice. Subscribe for more clear, 3D explanations of cancer research and treatment.